Hey, it's Dr. Dinh here. Just had a pretty busy week working in our telemedicine practice and have been seeing a pattern here with more and more patients having issues. And so I wanted to just give a little information for our audience members and for our listeners out there on some information, some helpful tips, and some clues about some root causes of why you're having sleep problems. So I commonly see a lot of patients having issues that they've just been tolerating for many years now. Less common do I see patients have issues falling asleep. Most of the times patients don't have any issues falling asleep, but after an hour or two they find themselves waking up around 1, 2, 3 o'clock, and many times they wake up just feeling completely wide awake. Why is that happening, or why is that the case? Is it because you're missing a sleep medication? Typically when you go to your doctor and you complain about trouble falling asleep or staying asleep, usually a sleep aid or a prescription medication is offered. That is not going to fix the root problem for why you're not able to sleep. So what are some causes of problems staying asleep at night? Well, there are a few that come to mind. And in this short clip, I'll talk about the most common reasons that I find for my patients. The first thing is they have blood sugar regulation problems. You see, at night, the liver tries to make extra sugar for us. And when we combine that with a dinner or a meal sometime close to bedtime, that cumulative total sugar level can make your body wake up. And it's something called the dawn effect, or the dawn phenomenon, of why someone could be more alert, more awake in the middle of the night. So what's a trick to be able to help lower the sugar levels during the night? And a trick that I teach my patients is to incorporate a tonic before they sleep. Just a apple cider vinegar, or like a vinegar tonic. All you need is 1 or 2 tablespoons of apple cider vinegar in maybe 4 ounces of water. You don't want to drink too much water before you sleep, so keep it lower in volume. But that can actually help blood sugar levels at night and make your blood sugar not rise too much in the night. Another reason that I find patients having sleep issues and staying asleep at night is liver problems. Our environment is inundated with toxins and things that accumulate in our body. Our food has a lot of chemicals in it. And a lot of times people are incorporating things like alcohol or sugar throughout the day, and that can irritate the liver. And when the liver is irritated at nighttime, that can also cause you to wake up, and tends to be around that 1 to 3 a.m. time. So the best thing you can do is treat your liver with some tender love and care. So try to avoid alcohol. If you must drink, try to drink during like the early hours of the day. And try to incorporate some things that can be very nurturing to the liver. Things like milk thistle. Incorporating milk thistle tea can be very helpful. Incorporating cruciferous vegetables in the brassica family of vegetables, that can be also very nurturing for the liver and detoxifying. Those foods include things like broccoli, cabbage, Brussels sprouts. Try to get those sprinkled in throughout your day. And then the other thing is making sure you're eating a moderate to high protein diet, because the liver actually needs a lot of amino acids from protein to function well. And so I feel like some of those tips could be helpful for a lot of people out there, especially if they're trying to figure out, what's up with this sleep problem. And if you are having sleep issues and kind of want to see, well, are there any things on my labs that are informing me that my liver is needing more support? You could easily take a look at your liver enzyme levels, typically collected on a comprehensive metabolic panel that your doctor will order, and look at your AST and ALT level. what I like to look for ALT levels is to make sure that the ALT levels are 30 and below, ideally in the mid-20s, like 25 or 26. If it's higher than that and tends to be higher than that, then most likely you have some chronic liver problems, some fatty liver, or stress to your liver. So doing all of those cruciferous vegetables, milk thistle, things like beets, it can be very helpful for your liver. That's it for today. I hope this was helpful. Have a good day.